Hello, my name is Viola Pierce, and I have Serena Gerfity, Kendra Mickens, and Dominique Arocho here. Um, we're doing our Unit 3 XP, Imagine Your Personal Health Team for Healthcare Technologies, um, with Ashley Foreman as our instructor. The first question that we're charged with is we're charged with building your own personal health team to keep yourself safe. Who's on your team? So we imagine that on our team we would have occupational therapists, dietitians, a physician provider, a nurse, a respiratory therapist, a physical therapist, your NA, your nurse assistant, one or two. Each of these clinicians will go around on a daily basis and everyone will be informed about the care of each of the patients as they go throughout their day. How do they communicate? We imagine having an EMR that that was very clear to the patient and also very clear to the clinicians whenever they walked in the room. They had the ability to access the EMR by badging in. The EMR would be on the board. They would be able to touch screen, scroll up, give the patient their information, their lab work, their X-rays, as they go throughout the day. The patient also would have access to this information. It said how would they communicate? Well, each nurse would have a smartphone, and with that smartphone, there would be push notifications, and the push notifications would let them know if the patient was in danger, any lab work that may have come back. They would know exactly when the lab work came back, whether the patient was in the tag. These push notifications would go to their phone. And what happens if the lab was wrong? You would have a real-time kind of root cause analysis where you would investigate at that time what was going on with that lab, the reasons why it was wrong, whether it was a nursing error, whether it was not positive patient identification performed per protocol, or whether it originated in the lab. Now we'll turn it over to Dominique, and she will continue.
Okay, so when we think about our medications, the first thing that comes to mind is to use our EMR because that's really what we should be using to scan the patient, scan ourselves, and then scan the medication. But taking that a couple of steps further, once we scan the medication, the EMR will populate a screen that will give you a list of side effects for all of those for that particular medication. So, for example, if we're giving our patient vancomycin for antibiotic treatment, one of the common symptoms of vancomycin is red mean syndrome. When they get really red in the face, they feel hot and flustered. And you want to explain this to the patient that could be a possible symptom that they would possibly get within 30 minutes to an hour or even later. However, the EMR will prompt you to not only do it, but to either confirm or deny or decline that you actually gave that information to the patient. And then in alliance with us using the EMR, this will also interact with the patient to make sure to let them know that we're including them with their hospital stay. So then after you would confirm that you did give the patient these symptoms, there's for that particular medication, so vancomycin, there would be a screen on an area that you would come back into to document against that you check to see if the member or the patient is displaying any signs of those side effects or symptoms. And whether they do or they don't, you will still document against that medication. A lot of times we document patients' vital signs, say, every 4 hours. However, I think for certain medications, it would be really cool if we can document the vital signs and their clinical presentation documented against the actual medication versus just documenting against the scheduled time for vital signs. And that would all be in the EMR, which would be accessible to all of the disciplinary team that has access to the patient's health care. And then that way it'll allow us all to be able to look at it and have any additional questions, and then it'll also let the patient, if the patient has access to it, to confirm or deny that yes, they did receive this information, and yes, the nurse did come back to check to see if they had those particular signs or symptoms. And that'll also help educate the patient on the medications that they're taking. So now I'm going to pass it on to Serena.
Hi, so we also have our electronic health record with us. So for us to keep it, we're going to have it a sterile chip that's embedded into our wrist. So that way it's always with us and available when we need it. And then for those cases of an emergencies where the patient is unconscious and can't, give the access to it, they can be override with a scanner. All the paperwork can be uploaded to the EHR Viva site that belongs to the patient. You have to have the password. So like every admission, there would be a new password, kind of like a new HIPAA password, like when patients are admitted, but instead it's for their medical health record. And then if you needed it for, if you needed to override it for emergencies, you're only going to get the patient's medication list and their past medical history list. So that way you're not having full-blown access to that patient's medical record without their knowledge. And then I'm going to pass it on to Kendra.
Well, I'm just going to discuss kind of a summary of some of the things that we looked at as present technologies that are being used right now, and then some things that we are looking out for that may be coming up, and then challenging some of these things to go even a step further than what's suggested. So in an article by Lindsay Gilpin in 2014, and this is on techrepublic.com, she wrote an article about the 10 technologies changing the future of healthcare, and some that stuck out to us were the wearables that they're talking about in technology. There have been this big move in all these Fitbit challenges. So with wearable technology, why can't in the future, instead of it just being a plain patient ID bracelet, why can't it be more of a Fitbit bracelet that now tells us up-to-date real-time information on vital signs? A lot of times patients are having changes, but they don't recognize what's happening to them. So with a bracelet, we can see, just like when we look on telemetry units and we're getting up-to-date information on cardiac rhythms, the Fitbit would then tell us what's changing. Are the respirations, pulse, blood pressure still within normal limits, even before a patient can recognize that they're having changes. And then, of course, the health informatics is a big part when we look at these technologies changing healthcare. So even with the EHR, it's even going, again, a step further. When a person comes onto a shift, knowing all those people on the team, who they're going to be serving, that can then be a picture of that employee in the patient's room that comes up so that the patient, for safety reasons, is aware automatically who's on their team even before they come into their room. And then this same author, Lindsay Gilpin, wrote another article about 10 new devices, apps, and inventions to watch. One of those things are smart pills. So when we talk about things like medications and looking at side effects and untoward effects, with these smart pills, if a patient takes this pill that has this technology, the technology in the pill can let us know if they're having an adverse effect, again, immediately, as opposed to waiting for them to start having things like hives or reporting itching, things of that nature. With this technology, they also have now the smart patches with Proteus Digital Health, who makes smart patches that go along with their smart pills. The person wears the patch and it can then tell them when the next pill is due, again, how this person is doing with the pill. But again, going a step further with the future, why can't these patches tell us what the therapeutic level is of the medication is? Starting the need for unnecessary sticking of patients, which is always a risk. Safety, whenever you have to stick a patient, may also increase compliance with patients so that they're more compliant with having their medication levels monitored, things like lithium, things like digoxin. So these are just some of the things that are out there. They're coming, but again, we're challenging for safety reasons one step further for some of these things that are on the horizon.
And that concludes our presentation. Thank you.